Greetings from Citizens Health team under Academia IAPSM Connect. We have started a series, People's Health It Matters, and for this, today we have a very prominent speaker, Dr. K. Chandrasekhar. He is working as a professor and trainer at the Department of Saudi Board of Family Medicine as a research coordinator at a family medicine department, Buraidah, Al Qassim region. On behalf of audience, a very warm welcome to you, sir.
This is Dr. Chandrasekhar. So thanks for the first of all thanking to the IAPSM team of the national level as well as the state level for giving this opportunity to give the lecture on self-care, diet and adherence for the hypertensive patient. As you all know, hypertension is one of the global problem can be seen in the developed countries as well as the developing countries. And if you see the definition for the hypertension, most of the definitions will give more blood pressure more than 140 systolic and more than 90 diastolic can be labeled as hypertension. And this classification can also be applied to the pregnancy and lactating mothers also. Why? Because some of the, say in case of the diabetes, there will be different in the adult diabetes classification as well as the pregnancy diabetes classification based on the fasting blood sugar. Similar way, but in this other hypertension, there is no difference. And coming to the magnitude, about 25 to 30% in the developed countries, and developing countries about 10 to 20% of the population. And countries like in India, having 10 to 20% is also a big figure when it goes to the term of 1.4 billion population in India level. So coming to the hypertension is also a risk factor for coronary heart disease, stroke, heart failure, kidney failure, vision, and aneurysms in the vessels. And we, as a common people, they should know about warning signs. That is more important factor. So when anybody is having the severe headache, chest pain, difficulty in breathing, nausea, vomiting, vision changes, these six will be commonly and usually labeled as a warning sign. Anyone is suffering from this warning sign, attentively they will go to the nearest healthcare center to get the better solution. Coming to the prevention, as you all know, for the any disease, the primary, secondary, tertiary prevention will play the role for whatever the disease, not only for the hypertension, any communicable, non-communicable, we can label in the form of primary, secondary, and tertiary prevention, of which under the primary prevention, self-care is also one of the prominent factor. Under the self-care for, to the hypertensive patients, one of the cost less effective intervention is health education. So with the simple health talk, we can give the message to good number of the people to control certain diseases, especially in the hypertension. And second one is lifestyle modification. Lifestyle modification in the hand of the public as the healthcare professionals or the community leaders and politicians and other advocacy people can give some importance about lifestyle modification, not only for the prevention of the hypertension, majority of the non-communicable disease can be prevented, of which one of the adaptable patient persons can change as a smoking habit, alcohol habit, weight reduction, promotion of the physical activity. These type of inculcating habits must be started from the beginning itself, before the onset of the disease. These inculcating good habits to be adopted by the public. This message to be percolated to the community to prevent majority of the non-communicable diseases. Coming to the monitoring of the self blood pressure, nowadays there are many blood pressure equipment is coming in the market. It's hardly available to 2000 to 3000 INR in India. So you can purchase, majority of the families can affordable self monitoring hypertension machines. With that, people will be get alerted. But we should not go this monitoring very oftenly, at least once in a month can be monitored is the best suggestion. And coming to the stress reduction, there are many ways are there by doing the physical activity and meeting with the friends and social participation definitely will reduce stress that indirectly decreases the hypertension. Visiting to the doctor and medication adherence. So we should have in the developed countries the literacy rate is very high. People they themselves will visit to the healthcare centers very quite oftenly, but places like in developing countries, third world countries need some motivation, need some education to visit the health centers. That is also one of the point to be addressed. And coming to the diet is also very important factor. So we can educate the people to the community as half of the plate, food plate pyramid education is best, of which 50% will be filled with rice and other cereals, and 25% with the vegetables, and remaining 25% with the fat. Yoga and meditation is also, government of India is giving lot of importance. Even other countries also giving yoga and meditation for the prevention of the diseases. But there we need authentic literature support. Definitely we can go those things. And keeping a logbook for the BP recordings, that is also important. So
Yeah.
logbook maintenance and the tracking of the blood pressure, this is very, very important. So tracking in the sense in the community, if the blood pressure recording will be done in the school, and suppose some students are having the high blood pressures in the school level, they tend to become the hypertension in the coming future, maybe after 5 years or 10 years. But those who are showing the low blood pressures in their school levels tend to become the low chances of the development of the hypertension in the future. So this tracking is very, very important to be followed in the institutes as well as the community also through the healthcare professionals or any supportive people. And coming to the dietary approach for the systemic hypertension, this is nothing but also called as a very, very familiar jargon is DASH jargon. DASH in the sense nothing but the diet contains huge amounts of the vegetables, fruits, and whole grains. That is only the DASH. And coming to the adherence, five different dimensions will be observed regarding the adherence. And adherence in the most of the hypertensive patients, as the disease nature is longer duration of the control of the hypertension, and people need to take the quite long periods for the control of the hypertension. They tend to not to take the regular medication. Sometimes there is a chance of missing the tablets due to the different factors. These factors could be social and economic factors. Sometimes burden is there to purchase the medication, and therapy related factors like sometimes amlodipine is prescribed, but amlodipine is not available in the primary health care centers. That is also one. So in that need to replace disease related factors. Sometimes people who are having the diabetes and hypertension, they will prescribe the AC inhibitors. But AC inhibitors last 2 years they have taken, suddenly AC inhibitors is out of the stock in the pharmacy. Those factors also plays a role. And patient related factors. Patient themselves feel comfortable and they will not go to the hospitals for the adherence purpose. And healthcare system related factors is also plays a role for the adherence. So these are all about what is the hypertension we discussed, levels of the prevention, health education, diet is dash, therapy is nothing but fruits and vegetables and dietary factors. Dietary fiber is important. And on the whole, health promotional activities, one of the important one is physical activity. At least they must practice 30 minutes of the physical activity out of 5 days in a 7 days of the week. At least 5 days in a 7 days, also called as a 150 minutes of the walk per week, or 30 minutes per day, 5 days out of 7 days in a week is mandatory to practice for not only for the hypertension, many diseases. This has to be inculcated, to be adopted as a physicians, as a healthcare workers, as a responsible citizen of India as well as the world responsible citizen person. So
So, so sir, a few questions have came to my mind. So, what
yeah.
type of foods to be avoided with high blood pressure?
So naturally, we all know saturated foods to be avoided. That is very, very important. So oil-rich foods and also extra salt. Certain things, pickles, it contains a huge amounts of the salt and poppers. And Indian diets and throughout the world, people, some of the third world countries, they used to practice keeping some salt during the after finishing the lunch. They will keep some salt in the diet, so that is also unnecessary. That salt is not required, but the palatability of the individuals, people will incline to take that practices. As far as possible, stored foods and sweeteners, also Coca-Cola, Pepsi, and those things is also need to be avoided. And frozen meals and canned foods also. They will keep high amounts of the salt as a preservative. And on the whole, what I mean to say is extra salt to be avoided, and the salt requirement is also 2 to 4 grams per day actually. But how to take the salt 2 to 4 grams per day means you spend your salt intake just as your money. So in the market, 1 kg of the salt is there. That will be in the 4 members in a family is there. They can utilize at least 3 months. 1 kg, 4 members, 3 months they can take means they are approximately or closely they are taking 5 grams per day, less than 5 grams per day. They are consuming that salt of 1 kg available, it taking within a 1 month or 2 months that is finished. So of course, somebody taken outside or something is fell down from as a usage, that's a different story. But on the whole, if they consume their salt within 2 months, means they are consuming more salt. Okay, thank you very
Yes.
much. Good question. Okay.
One more question, sir. Can I eat rice if I have high blood pressure?
Yeah, you can eat the rice because of the Asian countries is contributing 60 to 70% of the population, and most of the Asian countries people will eat carbohydrates as a predominant, of which rice will be the maximum rice eaters. So in that you can, but better to eat the brown rice where it contains the huge amounts of the fiber. Uh, Whereas in the white rice, so much polished rice, it contains very less fiber diet. And as you all know, fiber diet will reduces the blood pressure in most of some studies is revealed. In addition to that, this is important brown rice to be taken, but rice to be taken, but on the whole to be controlled. So as you all know,
And
balanced diet, yeah,
yes, sir. And also,
70%.
what vitamins will reduce the blood pressure, sir?
Yeah, this is also when any patient is become the hypertensive, the first question we'll ask to the physician what vitamins to be taken, how we can prevent the disease, how we can control this disease. Vitamins in the literature is such that vitamins, magnesium, vitamin D is one of the factor, and magnesium and potassium also. Magnesium and potassium are not a vitamins. These are two are the trace elements. But vitamin D is abundantly available in the market. When we go for the morning walk at the sunrise time, for the white skin people, 10 minutes, black skin people, at least 30 minutes, will we give you good amount of the vitamin D. It's not a cost impact. Even in the market is also it's available vitamin D once in a weekly solutions also 60,000 something like that. But these are the some studies is supporting the literature in view of the vitamins in relation to hypertension.
Is there any screening advice for prevention of hypertension, sir?
Yeah, definitely there is a screening advice. So most of the countries is following adults 18 years and above when they visit to the health centers, they must go for the checking of the vitals. One of the event under the vital is hypertension screening. But that is when anybody is coming to the hospitals and health centers, this will be practiced. But whereas in case of the routine checkup, 30 years and plus, once in a year, voluntary, they can go and check their blood pressures. That is also an important tool for the detection of the disease at the early. The outcome will be early,
Okay.
known fact.
And also, sir, what are the factors which are affecting the adherence in hypertension?
So, as I told you, WHO and earlier also I adherence factors in the beginning. So, according to the WHO, they estimated 50 to 70% of the hypertensive patients are non-adherent. This could be due to social factors, economic factors. Sometimes private sector people need to purchase their medication is also a big task. And therapy related factors, as I told you, disease related factors, patient related factors, healthcare system related factors plays a vital role in the adherence. But on the whole, what I mean to say is, so we can make it through health education and other support from the healthcare workers, adherent and reminders to be given to the population. If the technology is available, if technology is feasible, we can go for attention to the patients in the form of the reminders. Somewhat we can reduce the adherence also from the healthcare side, and as an individual side, they needed to commit to take the medication regularly.
Okay. And also, sir, is there any best intervention for the prevention and control of hypertension?
So this is very good question. In my personal perspective, as well as the literature support and also in the textbook support, the best way for the prevention of the hypertension and also the non-communicable diseases like diabetes, hypertension, cancers, rheumatic heart disease, even immune-mediated diseases. All these diseases need at least 30 minutes of the physical activity per day is required. Out of 24 hours in a day activity, at least 30 minutes can be spared for our personal life. Remaining 23.5 hours can be spared for the community, society, family, country. So this is my message. Definitely make a habit to practice these things. And one more thing I would like to say, my Family Medicine Academy has given good support for to conduct with the Indian Association of the Preventive and Social Medicine for the awareness campaign about the hypertension. This is only prevention part. I'm not a clinician, so clinicians will tell about more details about type of the medication, type of the antihypertensive medication, and dose and frequency, when to change, what other things to be taken. This will be discussed further with this public perspective, this prevention. So this is take-home message, and everybody has to practice physical activity. Thank you very much for giving this opportunity for my current institution here as well as the IAPSM Academy panel.
Thank you so much, sir, for giving your valuable time for us. Indeed, it was very informative and eye-opener session for everyone. Thank you so much, sir. Stay tuned for next topic for the Citizens Health channel and subscribe for getting regular updates. Thank you.
Thank you. Thank you very much.
Thank you, sir.